The CIA bought the world's entire supply of LSD in the early 1950s. Every last dose. They paid $240,000 for it, then distributed it across hospitals, prisons, and clinics under fake foundation names, asking researchers to conduct experiments on people who had no idea they were test subjects. That's not conspiracy theory. That's documented history. And it's just one fragment of a much larger pattern. A system where scientific discoveries aren't suppressed because they're wrong, but because they're dangerous to the people who profit from keeping them hidden. What you're about to hear isn't speculation. These are classified programs, buried research, and deliberate erasures backed by internal documents, government files, and testimony from the people who were there. Some of these discoveries could have saved millions of lives. Others would have reshaped entire industries overnight. But each one threatened something more valuable than truth: control. And when that happens, science doesn't just get ignored, it gets weaponized, classified, or burned. The pattern repeats across decades and industries, government agencies experimenting on their own citizens without consent, corporations manipulating research to protect profit margins, scientists silenced, documents destroyed, and evidence rewritten. You'll see it in pharmaceutical trials, chemical warfare programs, and even the food you eat every day. The scope is staggering. But what's more disturbing is how effective the suppression has been. Most people have never heard these stories, and the ones who have often dismissed them as fringe theories. That's by design. Let's start with something that sounds impossible. In April 1953, the CIA launched Project MKUltra, a program designed to master mind control through drugs, hypnosis, sensory deprivation, and psychological torture. The goal was simple: find a way to extract confessions, erase memories, and program human beings like machines. They tested on mental patients, prisoners, drug addicts, and prostitutes, people described in internal memos as those who could not fight back. One patient in Kentucky received LSD for 174 consecutive days. Others were subjected to techniques so extreme that an unknown number died, and many more had their lives permanently destroyed. Here's what makes this worse. The CIA didn't just conduct these experiments in secret facilities. They embedded them into everyday institutions. Hospitals ran trials without informing patients. Prisons became laboratories. Universities participated through grants funneled via front organizations. The scale was massive. Over 150 research sub-projects were funded under MKUltra alone, spanning years and involving countless unwitting participants. And when investigations finally began in the 1970s, CIA Director Richard Helms ordered most of the records destroyed. What survived was only a fraction of the full picture, but even that fraction revealed a system built on deliberate human suffering in the name of national security. MKUltra wasn't the only program operating in the shadows. Around the same time, the Department of Defense launched Project 112. A biological and chemical weapons testing program that ran from 1962 to 1973. Authorized under Defense Secretary Robert McNamara and funded by every branch of the US military, the project involved approximately 6,000 service members who participated in tests designed to measure vulnerabilities to chemical and biological attacks. The problem? Many of those service members had no idea they were being used as test subjects. They were told they were part of routine training exercises or equipment evaluations. In reality, they were being exposed to nerve agents, biological toxins, and other hazardous substances to see what would happen. The Department of Defense planned 134 tests under Project 112. 62 were cancelled. 46 were confirmed to have taken place. But even after promising Congress full disclosure, the Pentagon was accused of withholding critical medical documents about the tests, documents that could have helped veterans understand the health problems they developed years later. Some developed unexplained neurological conditions. Others suffered from chronic illnesses that military doctors couldn't explain. And because the records were classified, buried, or destroyed, many of those veterans never received the care or compensation they deserved. Think about that for a moment. These weren't enemy combatants or foreign agents. These were American soldiers, people who volunteered to serve their country, used as experimental subjects without their knowledge or consent. And when the truth finally started to emerge, the response wasn't accountability. It was obstruction. But government programs aren't the only place where scientific discoveries get buried. Sometimes the suppression comes from industry, and the consequences reach far beyond military personnel. In 1932, the U.S. Public Health Service began a study in Tuskegee, Alabama, designed to observe the natural progression of untreated syphilis. The participants were poor black men, many of whom were sharecroppers. They were told they were receiving free medical care for bad blood, a term that could mean almost anything. What they weren't told was that they had syphilis, that effective treatment existed, and that researchers had no intention of providing it. By 1947, penicillin had become the standard treatment for syphilis, widely available and highly effective. But the study continued for another 25 years. Researchers didn't just withhold treatment, they actively prevented participants from accessing care available to others in the area. They lied about the purpose of painful procedures, sending letters with headlines like, "Last chance for special free treatment to ensure men showed up for spinal taps that had no therapeutic value." The justification? The knowledge gained would benefit humankind. The human cost was catastrophic. 28 men died directly from syphilis. 100 more died from related complications. 40 wives were infected. 19 children were born with congenital syphilis. All of this was preventable. All of it was deliberate. And all of it was sanctioned by a government health agency under the guise of scientific research. The Tuskegee study didn't end because of ethical concerns. It ended because a whistleblower leaked the story to the press in 1972, sparking public outrage that finally forced the government to shut it down. But here's the disturbing part. Throughout those 40 years, numerous public health service supervisors oversaw the project. Reports were written, data was collected, and no one inside the system stopped it. That's the pattern you'll see again and again. Not ignorance, not accident, deliberate choice. The pattern extends far beyond medical experiments. It reaches into industries that shaped the modern world, industries that knew the truth decades before the public did and chose profit over safety every single time. In 1994, 7 executives from America's largest tobacco companies stood before Congress, raised their right hands, and swore under oath that nicotine was not addictive. They testified that the link between smoking and cancer was inconclusive, that their products were safe when used as intended, and that they absolutely did not target children with their marketing. Every word was a calculated lie, and they knew it. Less than a month later, a box of confidential documents from Brown & Williamson Tobacco Corporation surfaced. Inside were decades of internal memos, research reports, and strategy documents that revealed something stunning. The tobacco industry had known since the 1950s that cigarettes caused cancer, that nicotine was powerfully addictive, and that their own scientific research programs were nothing but public relations theatre designed to manufacture doubt. The strategy was brilliant in its cruelty. Instead of simply denying the health risks, which would have been too obvious, tobacco companies created what looked like legitimate scientific controversy. They funded studies designed to produce inconclusive results. They published research that cherry-picked data. They created entire institutes with respectable-sounding names whose sole purpose was to cloud the science and make it appear that experts disagreed about whether smoking killed people. But behind closed doors, there was no disagreement. Internal documents show that by the 1950s, tobacco executives understood without any doubt that their products increased the risk of lung cancer. They knew cigarettes were addictive, and they knew something even more disturbing. That cigarette smoke contained radioactive alpha particles with significant cancer-causing potential. They had known about the radioactivity since 1959, studied it extensively, understood exactly how dangerous it was, and deliberately kept that information from the public for more than 4 decades. When a 1998 government lawsuit forced the release of 30 million pages of internal documents, the full scope of the deception became undeniable. These weren't accidental oversights or honest mistakes. This was systematic suppression of life-saving information, orchestrated at the highest levels, maintained across generations of executives, all to protect an industry worth billions of dollars. The tobacco playbook became a template, Other industries watched and learned. In the 1960s, the Sugar Research Foundation faced a problem. Scientists were starting to link sugar consumption to coronary heart disease. Early studies suggested that sucrose might be just as dangerous as fat when it came to heart attacks and cardiovascular problems. This was a threat to an industry that depended on Americans consuming ever-increasing amounts of sugar. So the foundation did what tobacco companies had done. They bought the science. In 1965, they paid Harvard scientists the equivalent of $50,000 in today's money to conduct a literature review that would be published in the New England Journal of Medicine. But this wasn't independent research. The Sugar Research Foundation set the review's objectives, selected which articles should be included, and received drafts before publication. The final paper singled out fat and cholesterol as the dietary villains behind heart disease, while downplaying evidence that sugar was also a major risk factor. The industry's funding and involvement were never disclosed in the published paper. Years later, internal documents revealed another project, Project 259, which ran from 1968 to 1970. Researchers were studying how sugar affected triglyceride levels and cardiovascular health. The preliminary results were not favourable to the sugar industry. So funding was terminated. The study was never completed, the evidence of potential harm was never published, and the Sugar Research Foundation continued its public campaign to shift blame away from sugar and onto fat. For decades, Americans were told that fat was the enemy. Low-fat diets became the standard health advice, and during that same period, sugar consumption skyrocketed, obesity rates climbed, and heart disease remained the leading cause of death. The science that could have warned people earlier was suppressed, not because it was wrong, but because it was inconvenient. This wasn't limited to food and tobacco. The oil and automotive industries played the same game with devastating consequences. In the early 1920s, engineers at General Motors discovered that adding tetraethyl lead to gasoline prevented engine knocking and improved performance. They also knew it was poisonous. Internal memos from that era discuss alternatives, including ethanol, which was cheap, effective, and non-toxic. But ethanol couldn't be patented. Tetraethyl lead could. So despite knowing safer options existed, despite understanding the severe health risks, the industry chose lead. On October 26, 1924, workers at Standard Oil's Bayway refinery began dying. 5 men perished in quick succession after experiencing violent convulsions, hallucinations, and severe neurological symptoms. 35 others were poisoned. More than 80% of the facility's workforce either died or suffered debilitating illness from lead exposure. The deaths were so disturbing that newspapers called the substance loony gas. Public health advocates sounded alarms. Alice Hamilton, a pioneering toxicologist, publicly stated there were thousands of better alternatives to lead. She was right. General Motors had even patented some of them. But the Public Health Service, under pressure from the automotive and oil industries, cancelled public hearings that would have explored those safer additives. A Surgeon General's committee issued a report in 1926 concluding there was no real evidence that leaded gasoline was hazardous, though the report quietly urged further study. That further study was funded almost entirely by the lead industry. And when researcher Randolph Byers discovered in 1943 that children with lead poisoning developed behavioural problems, the Lead Industries Association threatened him with a lawsuit. His research ended. For decades, leaded gasoline poisoned the air in every city, near every highway, around every school. Children's developing brains absorbed the toxin. Crime rates, learning disabilities, and neurological disorders all showed correlations with lead exposure. The industry knew. They had always known, and they spent millions ensuring that knowledge stayed buried until it was far too late for millions of people. These aren't isolated incidents. They're the standard operating procedure when scientific truth threatens financial power. The pattern extended far beyond corporate boardrooms and into the most secretive corridors of government power. In 1962, under President Kennedy's authorization, the Department of Defense launched Project 112. The stated goal was to test U.S. military vulnerabilities to biological and chemical weapons. What actually happened was something far darker. Approximately 6,000 service members, most of them Navy and Army personnel, were exposed to live chemical and biological agents in controlled experiments. Many had no idea they were being used as test subjects. Ships were sprayed with nerve agents. Troops stood in contaminated zones. The tests continued for over a decade. When veterans began developing unusual cancers, neurological disorders, and autoimmune diseases years later, they asked questions. The Department of Defense stonewalled. Documents were withheld. Denials were issued. Even after promising Congress that all medically relevant information had been released, the Pentagon continued to suppress records. Of the 134 tests planned under Project 112, only 46 were ever confirmed to have occurred. The rest remain classified or were allegedly cancelled. No one knows for certain. The men who participated can't access their own exposure records. The chemicals used on them are listed as classified. Their illnesses remain unexplained. Project 112 had a subset called SHAD, Shipboard Hazard and Defense. The experiments involved exposing naval vessels to simulated attacks using sarin gas, VX nerve agent, and biological pathogens. Sailors scrubbed decks contaminated with toxins. They breathed air laced with agents designed to kill. And when the test concluded, they were told nothing. No medical monitoring, no warnings about long-term effects, just silence. But Project 112 wasn't even the most disturbing program running during that era. In April 1953, the CIA launched Project MK-Ultra. The objective was to develop techniques for mind control, interrogation, and psychological manipulation. The methods included administering LSD to unwitting subjects, conducting sensory deprivation experiments, using hypnosis, and testing extreme isolation techniques. Mental patients, prisoners, drug addicts, and prostitutes were targeted, described internally as people who could not fight back. In one case, a mental patient in Kentucky was dosed with LSD for 174 consecutive days. The CIA's MK-Ultra director arranged to purchase the world's entire supply of LSD in the early 1950s, spending $240,000 to control the global stock. The agency then distributed the drug to hospitals, clinics, prisons, and research institutions through front organizations, asking them to conduct experiments without revealing the CIA's involvement. Subjects were dosed without consent. Some were observed through one-way mirrors. Others were interrogated under the influence. The goal was to find substances that could extract confessions, erase memories, or turn individuals into programmable agents. How many people died? No one knows. In 1973, CIA Director Richard Helms ordered the destruction of nearly all MK-Ultra records. Thousands of documents were shredded. The full scope of the program, which funded over 150 research sub-projects, remains unknown. What survived came to light only because a small cache of financial records was mislabeled and escaped destruction. Those fragments revealed experiments so disturbing that even congressional investigators struggled to comprehend their scope. Drugs, hypnosis, electroshock, and sensory deprivation were combined in ways designed to shatter human consciousness and rebuild it. The program operated under multiple code names: MK Ultra, Bluebird, Artichoke. It ran in secret for over 2 decades, and when journalist Seymour Hersh exposed parts of it in the New York Times, the CIA admitted to some activities but insisted the program had ended. Documents declassified years later told a different story. The techniques developed under MK Ultra were refined, rebranded, and continued under different names. The research didn't stop. It went deeper underground. Then there's Operation Paperclip. At the end of World War II, the United States faced a choice: prosecute Nazi scientists responsible for war crimes or recruit them. The decision was made quickly. Over 1,600 German scientists, engineers, and technicians were brought to America, their Nazi affiliations erased, their records sanitized. President Truman had explicitly forbidden recruiting anyone who was an active Nazi supporter or party member. That directive was ignored. Documents were forged, backgrounds were rewritten. War criminals were given new identities and placed in positions of power within the US military and space program. Wernher von Braun became the face of the American space program, celebrated as a visionary. But von Braun had been a member of the SS. He ran the underground facility at Mittelwerk, where tens of thousands of slave laborers died building Phi 2 rockets. When he needed more skilled workers, he personally traveled to Buchenwald concentration camp and selected prisoners to be worked to death in his factories. His past was known. It was deliberately concealed because his expertise was considered more valuable than justice. This wasn't about a few individuals. It was systematic. The Joint Intelligence Objectives Agency and the Office of Strategic Services created entire networks to smuggle Nazi scientists into the country, falsify their records, and integrate them into American institutions. Some of these men were marginal participants in the Nazi regime. Others were true believers who had committed atrocities. The distinction didn't matter. What mattered was what they knew. And what did the American public know? Nothing. For decades, the full extent of Operation Paperclip remained classified. The scientists lived quiet lives, working on rockets, chemical weapons, and aerospace technology. Their contributions were praised. Their crimes were forgotten. Only after declassification in the 1980s did the scope of the program become clear. By then, most of the men involved were dead. Accountability was impossible. The knowledge had been transferred. The past had been buried. This is the architecture of suppression. It doesn't require a single conspiracy. It requires aligned interests, institutional inertia, and the quiet agreement that some truths are too dangerous to acknowledge. What follows isn't speculation. It's documented. In 1932, the U.S. Public Health Service began a study in Tuskegee, Alabama. 600 black men were enrolled. Nearly 400 had syphilis. None were told. The researchers wanted to observe what happened when the disease went untreated. They called it science. For 40 years, those men were studied, monitored, and deliberately denied treatment. Even after penicillin became the standard cure in 1947, the study continued. Doctors withheld the drug. They blocked participants from accessing treatment available to others in the area. They sent letters with deceptive titles like "Last Chance for Special Free Treatment" to lure men into painful spinal taps that offered no therapeutic benefit. 28 men died directly from syphilis. 100 more died from complications. 40 wives were infected. 19 children were born with congenital syphilis. The study didn't end because of ethics. It ended in 1972 because a whistleblower leaked it to the press. The outrage was immediate, but the damage was permanent. Lives destroyed, families shattered, trust obliterated. The justification? Knowledge would benefit humankind, whose humanity was never specified. This wasn't an isolated case of institutional cruelty. It was part of a broader pattern. Project 112 ran from 1962 to 1973 under the Department of Defense. Its goal was to test vulnerabilities to chemical and biological warfare. 6,000 service members were involved. Many didn't know they were exposed to nerve agents, biological toxins, and experimental compounds. Ships were sprayed with deadly substances to see how crews would react. Sailors breathed in clouds of pathogens while conducting routine operations. The tests were classified, the health consequences were ignored. Decades later, veterans began reporting strange illnesses, cancers, neurological disorders, respiratory failure. The Pentagon denied everything. When pressed, they released partial records, then more partial records. Documents kept surfacing that contradicted earlier statements. The full scope remains unknown. 134 tests were planned, 62 were cancelled, 46 are confirmed. What happened in the others? No one will say. The pattern repeats. In the 1950s, tobacco executives sat in boardrooms reviewing internal research. The studies were clear. Smoking caused cancer. It was addictive. It killed. The companies knew. They had known since the 1940s. But in 1994, executives from major tobacco firms testified before Congress. Under oath, they stated the evidence linking smoking to disease was inconclusive. They said cigarettes weren't addictive. They claimed they didn't market to children. Less than a month later, stolen documents from Brown and Williamson proved otherwise. 30 million pages of internal memos, research reports, and strategy papers revealed a coordinated campaign of deception. The industry hadn't just hidden the science, they'd manufactured doubt. They funded research designed to muddy the waters. They created scientific controversy where none existed. And it worked. For decades, the public believed smoking was a personal choice, not a corporate crime. By the time the truth became undeniable, millions had died. The companies paid fines but admitted no wrongdoing. The architects of the deception retired wealthy. Sugar followed the same playbook. In 1965, the Sugar Research Foundation paid Harvard scientists the equivalent of $50,000. Their task was simple: review the literature on diet and heart disease, emphasize fat and cholesterol as the culprits, downplay sugar's role. The review was published in the New England Journal of Medicine. No funding disclosure, no conflict of interest statement, just science, or so it appeared. For decades, dietary guidelines followed that script. Fat became the enemy. Sugar got a pass. Heart disease rates climbed. Obesity became epidemic. Only recently have internal documents surfaced showing the sugar industry knew the risks and paid to bury them. Project 259, a study funded from 1968 to 1970, showed sugar elevated triglycerides and increased heart disease risk. When preliminary results looked bad, funding was pulled. The research was never published. The data disappeared. The industry moved on. Pharmaceutical companies operate in the same shadows. Clinical trial results are supposed to be public. But a 2017 analysis found that 67% of trials from certain sponsors never reported results. Positive findings get published. Negative ones vanish. Tamiflu, a widely prescribed flu drug, had over 70 trials and 100,000 pages of hidden data. When researchers finally accessed it, they discovered the drug barely worked. Worse, buried results suggested it increased heart attack risk. None of that reached doctors or patients. The drug stayed on the market. Billions were spent. Publication bias isn't an accident. It's policy. 97% of antidepressant trials with positive results get published. Only 39% of negative trials see the light. The public gets a distorted picture. Doctors prescribe based on incomplete evidence. Patients suffer consequences no one warned them about. Leaded gasoline offers the starkest example. By the 1920s, researchers knew lead was toxic. Workers at refineries were dying in agony, hallucinating and convulsing. Alternatives existed. Ethanol worked. Other additives were available. But lead was profitable. General Motors and Standard Oil pushed it anyway. A 1926 Surgeon General report called for more study but concluded there was no immediate danger. That conclusion was shaped by industry pressure. For decades, research on lead poisoning was funded almost entirely by the Lead Industries Association. When Randolph Byers found in 1943 that lead-poisoned children had severe behavioral problems, the industry threatened legal action. His research stopped. Public hearings that would have discussed safer alternatives were cancelled. The science was clear, but the profits were clearer. Generations of children grew up breathing toxic fumes. IQ points were lost. Lives were shortened. The companies knew. They didn't care. These aren't anomalies. They're features of a system where profit outweighs truth and institutional interests override human cost. The architecture of suppression doesn't require grand conspiracies. It requires aligned incentives, complicit institutions, and the quiet understanding that some knowledge is too dangerous to allow. Dangerous not to people, but to power. The Nazi scientists weren't the only ones who understood that. Every industry that buried evidence, every agency that classified harm, every executive who chose silence over disclosure made the same calculation. Knowledge is control, and control, once seized, is never willingly released. The suppression continues, not because the methods have changed, but because they work. Documents still vanish, whistleblowers still disappear, profitable lies still outlive inconvenient truths. And the cost compounds with every generation that inherits the consequences of decisions made in locked rooms decades ago. The pattern is clear. The question is whether anything will break it. History suggests the answer. But history was written by the people who benefited most from keeping these discoveries buried.